Hi everyone, it's Dr. Kelly. Thanks for joining me tonight. I wanted to talk a little bit about an experience that I had this week, and I'm going to give you some details of my own personal health that gave me that experience this week and some of the whys behind it. So what are we talking about? We're talking about teeth. And the reason we're talking about it is because I hate going to the dentist. I've had many dentists over the last 40 years, and I've had many bad experiences. And so I don't like going to the dentist. I've had many teeth pulled out of my mouth. I have had many cavities. I have had many fillings. And so if you're like me and growing up you had cavities, guess what you got? You got one of those gray silver fillings. And the thing to understand about those is that they actually hurt your health. They're full of mercury. I want you to think about that for a minute. Those silver fillings, I want you to pause the video, go to the bathroom, open up your mouth, use a mirror, look inside your mouth, look at your teeth, and look to see if you actually have any silver fillings. Those silver fillings are really hard and they work really good, but there's mercury in there along with silver, tin, whatever else they put in, that amalgam, so it's a combination of different metals. But the thing that's a problem for you, human beings aren't supposed to have mercury in their bodies. It's toxic for you. Actually, it's specifically neurotoxic, meaning it can cause damage in your nerve cells or in your brain. Excuse me. So you don't want to be getting exposed to mercury. We get exposed to mercury through vaccinations. We get exposed to mercury through, remember the thermometers that were mercury thermometers? The bottom of the thermometer was all full of mercury. How many of you ever broke that open on purpose so you could play with the mercury and the little balls of mercury? You touched that mercury, it was absorbed into you. So through our dental fillings, through vaccinations, through playing with that mercury thermometer, those would be the top ways. Oh, through eating too much contaminated seafood like tuna. High doses of or frequent eating of tuna would be the top ways that you get exposed to mercury. Now, a couple of months before now, I actually had some testing done. And I did some element testing through my blood as well as through the urine. And one of those elements was mercury. And I didn't like my results. And in all honesty, I've had a filling that I've been delaying getting taken care of. For the reasons that I already told you. I've had many bad experiences. Now, over the last 10 years, maybe even shorter than that, over the last 7 years, I've worked on a plan to get fillings out of my mouth, and I've got many white fillings in. But this past Tuesday, I got the last one out. And that's thank you to Dr. Brian in Howard Dental. He's on Velth Avenue, and I'm going to talk him up a little bit tonight. So when you're looking for a holistic dentist, he's the guy to go to. So I'll get back to him in just a second. But talking about the mercury, so you know the why you want to get your fillings replaced and why you want to go to a dentist like Dr. Brian. So when I got my results, I was looking at zinc, I was looking at copper, magnesium, selenium, as well as iodine and lead. Okay, I can check that through the blood and I can check that through the urine. So mercury was checked in both ways. In my blood, my mercury count should be normal if it's less than 5 in their grading scale. Deciliters per liter, something like that, it's measured in. And mine was at 3.2. So normal at 3, Less than 5 is considered normal. But what did I just tell you about mercury? It's a neurotoxin. We technically shouldn't have any in our bodies. And I've got a value of 3. I didn't like that. And I knew that I had a mercury filling that still needed to come out, and I had been postponing it for the last 3 years. So it was time. I needed to have it done. I also checked the mercury level in my urine, and that came back looking even better. Normal value in the urine is 1.58 or less, and mine came back at 0.69. So still showing me that I have mercury in my body, that my kidneys are filtering it out. So it's taking some of that mercury out of my blood. It's going through my kidneys, and it's actually found in my urine. Again, that value looks normal, but I've never been able to go through a chelation process to get rid of mercury in my body because I still had mercury in my teeth. Now, you cannot chelate or force your body to bind and get rid of that mercury when you still have mercury in your mouth that you're not going to be able to get rid of. So that was something when I first started practicing this way that the practitioner I was with, didn't have knowledge of and just was chelating people all the time and never evaluated if they really had mercury in their body or not. And that's bad. That is not the way to do it. You have to get all of those fillings out of your mouth before you can ever concentrate on chelating that mercury out. So, knowing, although I have a normal value of mercury, I was not pleased with that result. I needed to get that last filling out. So, Dr. Brian from Howard Dental, he and I met about 5 years ago, and he had bought a practice in Howard. It's on Velp Avenue, again, Howard Dental. And the dentist before him practiced holistically. But Dr. Brian really wanted to take that whole patient into account and really have a holistic focus, really focus on health and help all of his clients, all of his patients who came to him for dental issues or dental work. He wanted to be able to help them the best that he could. So he and I connected. We met several times. I let him know how I work with people and what he wanted to focus on in his practice, which was fabulous. So since 5 years ago, he has really grown his practice and is doing things right for you. Now, what does that mean? Well, that's where I come in. That push came to shove. I finally went to have my last mercury filling taken out. Connected with Dr. Brian, and I had my appointment this past week. And it was great. It was really, really great. So from the front staff to the dental assistant, the hygienist, I've met all of the staff there. They're wonderful. And I have referred many people to Dr. Brian in the past, and all of them come back with raving reviews. So the key here is, when you're ready to get your mercury fillings out, any dentist can do it, but you want to do it the right way. And the right way means they protect you from the mercury that you're being exposed to when they start to drill that filling. So in an amalgam filling, remember that the mercury makes that filling super, super hard. But through eating, through saliva, through drinking things, mercury is still released as a vapor. Now your dentist is numbing you all up, and they're drilling that mercury filling. Mercury is going everywhere in the room. You're swallowing it. You're breathing it. The dentist is breathing it, and so is his assistant. That's really bad news. And when you know and understand that, there's no exception to continuing to do it that way. So I had a very cool experience. Dr. Brian takes out the mercury fillings the correct way. He protects himself, he protects his staff, and he protects you. So this was a really cool experience, and I want to tell you about a few different things that I've never had done before. So Dr. Brian wants to get to know you, again, because he is not just looking at you for your teeth, right? That's going to be the primary focus, but he wants to help you be healthy, just like I want to help you to be healthy. So the first thing he did was take a picture of me smiling, and then he took a picture of my teeth. Now, he didn't do any x-rays, and that's okay, because to minimize x-ray exposure is great. And these pictures that he took were pretty cool. The camera that he used had a lens about this big, which was crazy. So here's me smiling, and he's taking a big picture, all of my teeth. And I had to open really wide. I had to use a thing to spread out my cheeks so he could get pictures of all of my teeth. We put a mirror in my mouth. He got pictures that way and that way in my mouth. Great. Okay, no problem. And so then when I got in the dental chair, actually, up on the screen instead of x-rays came all of these pictures. And I was amazed at looking at these pictures because I look at my teeth every day. I brush twice a day. I floss, not as often as I should, but I'm probably going to do that a little bit more. But I floss, and sometimes I brush with coconut oil, and I do some oil pulling, and those pictures really magnified everything. And it was cool to use the camera, and I cannot tell you anything special about this camera, but I will tell you that Dr. Brian and I are going to be doing a video together. And so if you have any questions specifically for him or about his practice, you can let me know what those are, so I'll have those questions. And we're going to do a big question and answer session together that then, I'll post here on Facebook. But it was very cool looking at those pictures together and then looking at any areas that looked troublesome to him. Because remember, I've had a lot of fillings before, and you probably can't see it, but these fillings back over here, my teeth are kind of stained. They're stained from what I believe is because I've had those mercury fillings for a long time. And that can absolutely happen. But sometimes they can also look a little discolored because there's bacteria underneath the filling. So we talked about those things. And then we also talked more specifically about the tooth that I needed to have that filling removed. So he used a camera with a great big lens to just take regular pictures of my teeth. And then he took another camera that was on like two little prongs, and the prongs fit around my tooth. So with his handy-dandy tiny little camera, he put it around my tooth that was in question so he could look through the tooth, and light went through the tooth to see if there was decay underneath my filling, to look for cracks in my tooth, and to look for any suspicious areas before he started to drill. He did that special camera on this tooth, on a tooth up on the top, and also a tooth over here. And so it gave us some great information. It gave him more information than taking an x-ray just looking for cavities. It was mind-blowing. It was pretty fantastic. And the other cool thing is, not only are they super, super, super nice, he explains everything. Now, that's something that I try to do all the time as well, because when you understand something, you can value it more. And then you don't have to be afraid. How many people are afraid to go to the dentist? You don't have to be afraid to work with Dr. Brian, because he explains it. He's very gentle, and talked me through everything that was going to happen. So, of course, I needed to get numbed up, and he did a great job with that. No problems there. Then they put this, what do they call it, a dam, or this rubber thing around some teeth to help protect any debris from breaking up that mercury filling. Now, they try to take it out in the biggest chunk possible, but depending how big that filling is, they can come out differently. So he protected me from swallowing any of it. I got to put on this great nose piece that gave me 100% oxygen. And let me tell you, as you're laying there and they're working on your teeth, having this nose piece on first can feel claustrophobic because you've got this great big thing in your mouth, you've got this thing over your nose. I had glasses on and it's like, oh my gosh, all of this stuff all on my face. But the cool part was I concentrated on getting lots of oxygen in. So I wasn't going to inhale any of those mercury fumes. Plus, they also had a venting system that sucked any vapors away from all of us. So he protected himself, he protected me, and he also protected his assistant from any of us getting any of those vapors. Once he got the mercury filling out, those pieces came off. So if you are claustrophobic at all, it was a very limited period of time that that was done for. So if you're not experiencing all of that when you get a filling taken out, I encourage you to go somewhere else. Go to a dentist that cares about you, isn't going to expose you to more mercury, doesn't have to follow what the insurance says. Now, he does take insurance. Of course, you have to show, that you needed to change those fillings if it's going to get billed off to insurance. But that's what the camera work does. It proves that there's bacteria underneath there or that there's further decay and that it needs to be taken out and it needs to be replaced. So I had a great experience at the dentist this week, and I thought that was really important to share with you because, we talk about all the time, I'm not perfect, you're not perfect, don't expect to be perfect. But I did some testing on myself. I wasn't happy that my mercury level wasn't closer to 0, although it was still considered normal. That was my push to give Dr. Brian a call and say, you know what, I've got to get this filling out. I have to stop postponing it. I've been postponing it for years. I had worked to get several of them out all in a row, and they weren't taken out the right way. I needed to switch. I needed to get to the right dentist who would treat me like I want to treat my patients. So that's the way I wanted to be treated. Looked at holistically, know that my health is very important to me. These are my goals. I want to get it taken out safely, effectively, efficiently, and we're going to make a plan for this tooth over here because we could see that there's some decay underneath a filling that I had done numerous years ago. So I'm going to need to get that one replaced as well. And guess what? I'm not scared to do it. I'm pretty darn comfortable going there, Howard Dental, to have that done. And watch for in January is when Dr. Brian and I are going to record a video together. You're going to learn a ton. It's definitely worth your while. And so in the meantime, if you have any questions about fillings, getting them taken out, or what am I doing to chelate now? I don't have any mercury in my mouth anymore. So those mercury levels that I wasn't happy with, I can start to do things to get that mercury out of my body. And that's called chelation. There are many different ways to do it. And if you just go into it blindly, it can be dangerous. So you want to do it the right way. You want to make sure you're binding the mercury that is poisonous, that is toxic for you. And you also want to make sure that you're cleaving it or that you're, breaking the bond so you actually can get it out of your body. So there's several different things that I'm doing right now. We can talk about that another time. But for today, I just wanted to bring this experience to you because it was very, very good. I got my last mercury filling taken out of my mouth. I am now mercury-free except for the chelation that I have to do. Dr. Brian of Howard Dental did an amazing job. If you're looking for a dentist, if you need to get fillings out, or if you need other work, please give them a call. I'll put their website in the comments or in the text as well. And then, have a great rest of your week. And I will talk with you again real soon. Bye-bye.